Good evening, everybody. Welcome back to my educational channel where we explore new things, new products, topics of interest. And of course, if you have any questions, always leave me a comment at the bottom of the video so I can address them. That's what I'm here for. Try to do my best to share my expertise with everybody. And if there's any questions that I can't figure out, I will let you know also. So today I'm wearing my lab coat, trying to look a little bit more professional, wearing my tap-out t-shirt underneath for a whole nother reason. I'm going to tuck that away. And Toronto was cold today, really cold. And I thought it was appropriate to talk about something called Raynaud's syndrome. Raynaud's syndrome, as written over here, is affects about 5% of the population, and it can either be, it's basically a phenomenon where your extremities, poor circulation, they become white or blue, fingers or toes, it's painful, you get tingling sensations, numbness, and for most people it isn't harmful. But extremely annoying. Obviously, we're the most that we can do, or we try to do, of course, is to try to limit the symptoms and possible tissue damage. And some of the first things that we want to talk about, of course, when we're looking at Raynaud's syndrome, it can either be something that's what we call primary, and other things that are called secondary, and it can be caused by different things like arthrosclerosis or somebody using a jackhammer. So that vibration could lead to secondary Raynaud's, which can cause tissue damage. Okay, but for the primary, what we call the primary, is not due to anything, to any condition. But again, there's things that you need to keep in mind to try to avoid some of the exacerbating factors to this condition. So things that can worsen, of course, the symptoms are things like caffeine, because it's vasoconstricting, and also smoking. If you're a smoker and you're suffering from Raynaud's, that would be the first thing we consider is cut the smoking. As we know, it does a whole lot of other things that are bad for you. Also oral decongestants, so things for cold like the pseudoephedrine, also vasoconstricting amphetamines, triptans, which are medications for migraines, such like Imitrex, for example. That's a sumatriptan, as an example. And also they recommend that some supplements such as bitter orange can also cause vasoconstriction, which can aggravate Raynaud's. So those are some of the things that you want to avoid from a pharmacological standpoint. Non-pharmacological, so non-medication tips, medicated tips to do is, we're talking here about keeping, of course, comfortable temperature, layering clothing and wearing warm socks, using protecting gloves when washing dishes, always a good idea, warming up the car or the shower before getting in. And yes, we talked about minimizing caffeine and smoking and limiting stress, right? So relaxation techniques, also something that is useful. We talked, of course, about the things to avoid. So we talked about medications like triptans, decongestant, but also here we're talking about something, chemotherapy, clonidine, cyclosporin, which is for basically reduces your immune system. Ergotamine is also used, or vasoconstriction used, so for headaches and migraines as well. Beta blockers, and of course some of the things here that we're mentioning. Well, look, even cocaine. Obviously cocaine, not a good idea if you're suffering from Raynaud's syndrome. So we're talking about here in the little category here is that how do you help patients to relieve the symptoms. So we're talking about increasing movement to increase blood flow, massaging, wiggling your fingers or your toes, or moving your arms in a circular motion. Hand warmers, of course, things that can be useful if you're suffering from that. Now, if you look at the medications, if you're trying all that and it's still not relieving the symptoms of Raynaud, so those uncomfortable sensations in your extremities, well, we can talk to your doctor at that point and get you on some certain types of medications. typically used for blood pressure because they're vasodilating. So we're trying to vasodilate the extremities, the capillaries, to allow for better circulation. So we're looking at products such as nifedipine and melodipine, which would Adalat or Norvasc if you're familiar with the brand names. So there are dihydropyridines, and also other products that are considered or maybe more specific that were used also quite frequently. It's a medication called pentoxifillin. So that's also used to help increase the blood flow to your extremities. So that would be from a pharmacological standpoint. And are they really effective? The average, basically, that they reduce the frequency from about 14 to 18 episodes a week. It's something. That's about half, almost half of the attacks. But keep in mind that it can also cause edema and hypotension because they're vasodilators. Lastly, they also recommend some topical nitroglycerin ointment that can either be purchased or compounded by your pharmacist. So something to consider. And also something of interest is that, especially for the secondary type of Raynaud's, the ones that are due from atherosclerosis or somebody who's using a lot of vibrating machines, like guys are using jackhammers, they recommend using erectile dysfunction drugs such as Viagra or Cialis, and that can be used even in women. The only thing with that is that it gets kind of expensive, right? If you're going to take, Cialis, Viagra, right, once or twice a day, or every other day, that adds up. So I would highly recommend you try with the generic first and titrate up and see how you do that. And of course, you're going to get some side effects from using the erectile dysfunction drugs, which are called PDE5 inhibitors. And you can get things like abdominal pain, flushing, and headache because they're vasodilator, and headaches are pretty common with that. So that's my talk about the Raynaud syndrome. If you'd like to get some more information on this particular sheet that I'm scrolling down, which is basically your frequently asked questions about Raynaud syndrome, hit me on the comments, and I will PDF you a copy of this particular sheet that you can use for yourself, or if you're a health professional, you can use it to relay back to your patients. And listen, it's getting late already. Really appreciate your support on this channel, and thanks for typically we gotta ask for thumbs up. If that'd be great, that'll be very kind of you, and to follow me, that can get me some of course, some more motivation to get some more of these items and these more topics going on out there. So thanks again. Have yourself a great night. Alex out.